Myself, Dr. Aesthetic Checkup today. So, our learning objectives for today is to understand what is pre-anesthetic checkup, what are the aims of pre-anesthetic checkup, how to do pre-anesthetic checkup. We will be assessing risk for anesthesia and will be discussing on fasting guidelines. So, what is pre-anesthetic checkup? Pre-anesthetic checkup is essential first step in assessment and preparation of a patient for anesthesia and of course surgery in pre-operative visit. And when it should be done? It should be done a day before surgery or as soon as possible when patient is being admitted in any hospital. What are the aims of PAC? Why do we do PAC? Why do we want to do pre-anesthetic checkup of our patients? We want to know the disease process that the patient is suffering from so that optimization of the patient condition prior to administration of anesthesia and surgery could be done. We want to assess the risk and benefits of various options for anesthesia and formulate a plan. That means according to the disease of the patient and according to the underlying conditions of the patient, we will be assessing the risk and will be coming out with the plan of anesthesia. Like if we want to give a patient local anesthesia, general anesthesia or spinal anesthesia to provide patients with appropriate information and obtain consent for anesthetic procedure. Pre-anesthetic checkup is the appropriate time when a patient can ask his or her questions about the anesthesia as well as surgery, and even at that same time we can obtain consent for the procedures. Simultaneously, and because of these discussions being going on with patient and doctor, we are trying to allay anxiety of the patient, and this will develop a good relationship with the patient. And of course, the main aim of pre-anesthetic checkup is to decrease the incident of perioperative morbidity and mortality. So, how do we go for a pre-anesthetic checkup? As you people all have read how to take an history and how to examine our patients, we all have undergone with a number of classes and number of postings in surgery wards and medicine wards, and has been taught and discussed so many times how to take history, how to examine our patients, what investigations we have to do. So I will just summarize the specific things what we have to do. And of course, if you want and if you have any query, you can ask me there, and at the same time whenever you are having a query you can raise your hands and I am there to solve your problems. So when doing pre-anesthetic